Hi guys, uh, the NEET 2023 results are out, and I wish to give you a few suggestions regarding the subject, or else uh, the borderline ranks. If you got any borderline rank, what to do with that? This time, overall, people are saying that the paper was little easier than the previous exam, and so though they got similar marks, the ranks are very higher this time for the same marks. So uh, I mean, especially people who like 2015 batch who are preparing is their second entrance exam. So if you are getting like a borderline rank where it's difficult for you to get a desired subject, I wish to say that just I mean uh, analyze yourself that if there was any lack in your preparation, or it could be due to either your health issues or your family issues. You may feel like I didn't completely prepare, or else is there if I can improve, there is a scope for my improvement. If you feel like that, you can try for this INI set and the next INI set too. And so because at the end, you may get delayed, little more delayed, but at the end what you want, like even if you are 1 year delayed than your friends, at the end of like 10 years or 20 years, people will remember you as an general physician or surgeon, or else cardiology or DM and these things. So they will identify with your branch, not like the earlier you enter or the late you enter. It doesn't depend, but the whole thing is you have to analyze that is there any scope for improvement, either in your preparation or the way you give your exams. If you feel that you can improve, you can take a try. If you feel that no, I gave the best of my preparation, and even the exam was the best out of me, then I think it's better to attend the counseling completely until the last mop up rounds, so that you can get the best branch, or else the most interested branch which you want to get in. Because this point I just want to mention generally. Nowadays, with advent of technology, every branch is becoming like expanding in itself. So the whole thing is, there are no like apart from few branches, most of the branches uh, are having a lot of content, or else like the volume of the knowledge in every branch has increased. So now branches are like interdependent, so every branch adds some value to the patient. So be it pathology, even the other branches too. So I mean to say, before saying that this is a small branch, or is a good branch or a bad branch, or else a not so popular branch, don't go with these things. They like usually the people say that radio, then general medicine, then peds, or then ortho surgery or gynops. This may be the the priority list usually across like generalized. But I feel that there are ENT surgeons, and even ophthalmologists who are very good, excellent in their own fields. Even pathologists excelling in their careers, on par with other cardiology or even DM people. But I mean to say, the branch you are getting is important. More than that, how far you are excelling in that branch is more important than just that the branch itself. So the whole thing is how you excel in the branch you get in. That's the more important thing. So don't get disappointed if you get a borderline rank, or if you are not going to get the desired branch. If you have a scope to improvement, or else if you want to pursue, or else then you can go for that. You can stretch yourself. If not, better choose the best branch in this counseling, and go ahead with the branch and excel in that branch. And don't feel guilty about yourself. If you are like getting a borderline rank, don't feel depressed or guilty, like अरे मैंने कुछ नहीं किया, or else I could have done better. I mean, just analyze. If your effort was 100% in like during the whole preparation and even during the exam, so I mean, you should just feel, I mean, like contented with your preparation. Even you may not be satisfied, but like sometimes things may not be in your favor. It doesn't, and this is not the end point of any the whole career or whole journey of your life. I mean, and like this is not the biggest point even too. There are many milestones which you have to overcome with the life moves on. Like be it you are getting into a good relationship with children, with your family, and your other life goals. You can even goals for your society, or even getting into entrepreneurship in your field or other fields. So it may be one of the big milestones, but it's not the biggest one. There are still many things to come. So and one thing is peer pressure, or else a comparison. Sometimes I mean, we compare. We may not get a good rank, or we may get a moderate rank, but it becomes more painful when our friends, or else those who haven't studied better than us during the preparation, get a better rank. That's more hurting than the rank we get. So it's not like somewhere in their life, like in the past, maybe during their schooling or some part of life, they might have worked hard in attending the questions, or like the analytical skills may be better for them. They might have worked less hard than us, but they have some skills in their bag since like in the past. So don't draw comparisons. Just if you want to compare it yourself. Like how did you excel than the previous year? How did you perform better than the previous? So just compare with yourself. Don't draw comparisons with other. It just gives you like unnecessarily stress and burden on you. So I mean, because the preparation is not a smaller one, like 2 months or 3 months. Everyone knows that it's a long duration, almost for 8 to 9 months or 1 year, sometimes more than that. So I suggest that this preparation is like a tapasya, or else a penance, where you restrict yourself for many of the activities, like even the social media or family functions, or hanging out, or tours, or you like a sage. You are focused on one single goal, in and out. I mean, sacrificing all your enjoyments or comforts, and like sitting for 12 plus hours, more days. And so this is so don't get, you did all this hard work, so you may not get the fruit in this exam, but this hard work will never be a waste. It will help you in your next coming years, or next in your further journey. So don't get depressed, or don't be dull. So I suggest that analyze all the situations, like the present preparation, and I mean, can you carry it forward, or else your family thing, or else if you are 16 batch, we took a 16 batch, you have good time, like you got only 8 to 9 months. If you feel that you haven't studied, you can do better, you can improvise. So if you get a desired rank or desired seat, you go with it, or else you can give time and take time for your preparation, and don't be in hurry, like सबको आ रहा है, वो ले रहे तो अरे I will be isolated. No, don't will. In life you have to practice your own skill. Your friends may not be there every time with you. If they are going with the branch which they got, or with they are satisfied, let them go. You will make other new friends in your preparation. So continue, because it's you may get one more year delayed. all your friends will be there, so don't get that into mind. So for 2K16, if you feel that you haven't had good preparation, you take time, relax for a few days for a week, then start your preparation, but don't give a break. The moment you give long breaks, the subject is volatile and you feel new, it's very new, and so you will be left you will go in a backward fashion. So see that you continue the preparation, so and that will fetch you a lot, the NEET and the NEET next. For 15 batch people, if you are if you get a desired rank, it's good. If you're not getting desired rank and still you want to if you feel that you have a scope for improvement, you go with the improvement and prepare and go for further preparation. If not, analyze the situation and consider all the points, like your peak preparation or else your family things, and take a best possible decision and go with the best possible subject. And this is and one more suggestion for everyone is for all the rankers also, or choose subject very wisely. First, if there are few criteria about subject choosing, I can suggest that first see to that which subjects you like. Some people are very much interested in like surgery or else radiology. So understand yourself first. What kind of person are you? Are you good with night duties? Are you good with hectic schedule? Or you are a person who want more social life? You want to be relaxed. So identify your personality first. Then second point is scope of the subject. So project the subject in next 10 years or 15 years or 20 years. What would be the scope of the subject? Will it give will it progress with that along with the technology? Because when technology advances, so do the subjects also advance. So just check it whether it's a progressive subject or not. And then even in the subject also, like you divide into 3 criteria, like individual practice, like your own setup, and in corporate practice, and in institute or medical college practice. So you analyze the subject in these 3 aspects. So some subjects may be good in your medical college, but when you go outside, it may not have good scope. So analyze all the subject in these 3 aspects, and attribute these 3 aspects to your life, like what kind of life you want to live. Either you want to be in medical college or you want to have your own setup. So choose the subject of interest along with the scope of the subject. Okay, then these are the main things. And so if you plan it this way, and you should have good knowledge about other medical colleges apart from your own state, because you have good information about your own state medical colleges. Because why we should have good information is you are going to spend 3 years of your post graduation. Those 3 years are very valuable, because whatever you learn in your post graduation, that will have a huge impact in your practice, like good impact. If you sometimes we get into dilemma, should I go with the subject or should I go with the good college? If that is the dilemma, first I will suggest that choose the best first subject, because it's not like MBBS. Everyone is doing MBBS in Usman, in whatever medical college. It's like only MBBS aisa nahi hai. You have a separate stream. So the stream is first important, then comes the college, according to me. Because you can, if you are into that subject, you can improvise by doing SRship or by enhancing your skill by doing fellowships. So these are few suggestions I want to give. All the very best for your successful life. Thank you very much.